Vanakkam, I am Dr. Sujay Susikar, Consultant Surgical Oncologist at Kauvery Hospital, Alvarpet. Today, I am going to show you about the revolution that is happening in minimal invasive surgery and oncology in particular with the development of robotic surgery. Come, I will show you about the development of robotics and about the robotic surgery instruments and equipments as we explore in our robotic OT. Please join me.
So, surgery has been used since time immemorial in the treatment of cancers. So, what was traditional surgery for the removal of cancers? Was where you do a surgery, you approach the organ which contains the cancer and you remove the entire organ or the part which had the cancer. So, when you're talking about abdominal cancers, what happened was you had to take an incision, cut open the abdomen, like if this is the abdomen, you have to cut it open, go inside and then take out the cancerous organ. Like say the uterus had a cancer, we had to go in and take it out. But now with minimal invasive oncology and with robotic oncology, what has changed is that we do not need to actually cut everything to see it. We can go inside by using a small camera or a scope through which is only around say 8 millimeters in size, through which you can actually put your scope inside, and through that you can actually see what is happening inside the abdomen on your television. And other instruments through which you are going to handle, cut, divide and do tyings, ligatures. These instruments are also put in through small 8 millimeter incisions in your abdomen or any other chest or other parts through which it is approached and reached inside. So with this, we are effectively being able to do the same surgery which was done in open surgical oncology with the help of minimal invasive techniques, especially the robot. Now, what is the further advantage of using a robot is that the robo also has something where it adds something of precision. Because the size is reduced by tenfold and the vision is increased tenfold, what actually happens is it gives the surgeon the feeling of actually going into the abdomen, seeing everything in very close quarters and being able to move everything with a finesse which even our own hands and fingers are not able to afford, because we're able to translate the movements of our hands and fingers into an instrument which is 10 times smaller and so which is able to reach organs with more finesse at the same time through smaller and minimally invasive techniques. So what are the different parts of the robo? Here we have the Da Vinci 4th generation robo, which is the X system, and it has 3 essential components. The first thing is going to be the patient console. So this is what actually the patient console is on the right of me. This is what actually is going to have the arms, movements and the translational activity where the instruments are put into the abdomen and to make the activities. The next one is called the vision cart, where you actually have the things which are happening inside can be seen through the vision cart, and also it has the control panel and all the essential instruments in it. And the third most important part is called the surgeon console, which is right behind, in which the surgeon actually sits and does the movements and is able to translate his movements into active movements with more precision and more magnification inside the patient's abdomen. So the advantages, like I told you, are twofold. One is that there is going to be a 10 times magnification, and the second thing is that the movements are going to be more precise, more defined and more careful inside handling delicate organs and delicate tissues inside the human body. So as you see, there are 3 components here. This is the patient console, you have the vision cart, and then you have the surgeon console. And the movements are transmitted through these arms which have got multiple joints. You can see there are more than 3 or 4 joints here through which any movement is actually translated and moved from what the surgeon does with his fingers to what actually happens inside the patient's body. Thank you.